My name is Valentine Chena, and I'm here to do a demo for neurovascular assessment. And I will assemble my surprise, which I have them here. I have a reflex hammer, Q-tip, 2 paper clips, and a pen. So I'll go ahead and confirm the doctor's orders. And I have an order to do a neurovascular assessment for my patient. I will approach my patient. I'll perform hand hygiene and identify my patient using 2 identifiers. Hey John, can you confirm your name and date of birth, and may I use your wristband?
My name is John Boro, date of birth May 27, 1970.
That is with my record. So I have an order from the physician to have to test your neurovascular, to do a neurovascular assessment on you. Are you okay with that?
Yes, I'm okay with that.
Can you consent to be on the video?
I'm John Boro. I do consent for videotaping for a complete assessment.
Okay, so the purpose of this test is to, the purpose of this assessment is to test your sensory and neural functions. And I will then go ahead and do that. And I will sometimes be asking you to close your eyes. Sometimes I may touch you. Are you okay with that?
Yes, I'm okay with that.
Okay, then I'll go ahead then and start with the sensory response. I'll be using the Q-tip. So the Q-tip has a soft and a sharp side. So I want you to tell me when I'm touching you with the soft or the sharp side, and I'll ask you to close your eyes.
Soft, sharp, soft, sharp.
Okay, then I will go ahead and do a perception of movement. So John, I'll ask you to hold your arms out, and I will lift your fingers. Let me know whether I'm lifting your fingers up or down with your eyes closed.
Up, down, up, down.
Okay, he can be able to identify that. So I'm gonna go ahead and do a 2-point discrimination using the paper clips. So I will be I'll be pointing you with these 2. Let me know when you feel 1 point as opposed to 2.
2, 2, 1.
Okay, so I'll go ahead then and measure the distance and document that. Then I will hand you something on your hands when you're closing your eyes. Can you let me know what this is?
It's a pen.
Okay, thank you. You can be able to identify that clearly. So then I'll go ahead and ask you to stretch your arms like this, and I'll write a number. Please let me know what number that is.
That is 3.
Okay, he can be able to identify that. So John, I want you to go ahead and close your eyes. I will touch a body part. Just let me know what body part I'm touching.
Shoulder, arm wrist, knee.
Okay, then I will go ahead and do a deep tendon reflex using your arm. I'll be using your bicep. So I want you to rest your arm on my arm, and I'll be using the sharp side of the. Okay, so it's a +2. Oh, you didn't have to close your eyes. Sorry about that. I forgot to ask you to open your eyes. It's a +2, which is an expected response. So then I'll go ahead and do a patella tendon reflex. I'll draw a J from the oh no, the patella. I'm gonna be using the knee, the knee patella, and I'll go ahead and use the front side. So I want you to relax your foot. Let me move this a little bit. Relax your foot all the way, and then I'll identify the patella of the knee, and yeah, it's a +2. Now I'm watching for a quad contraction or a lower leg extremity extension, and I identified that, so that is a 2. So then I'll go ahead and do a plantar reflex using the head of the hammer, and I'll be drawing a J from the plantar to the big toe. I'm trying to see whether there is any carrying or flaring, which is abnormal, and let's go ahead and do that. So from the patella, I'll draw a J to the big toe. So I'm seeing a lot of carrying, which is normal, but there's no flaring, so no abnormal finding. So I'll then go ahead and do an ankle cronus. So I'll ask you to straighten your leg like this. I'll do dorsiflexion and then let go to observe whether there is any twitching. So relax your leg. I didn't notice any twitching, so that's a normal finding. Then I'll go ahead and do a cerebral function and proprioception. I will ask you to hold out your hands like this with your eyes closed, and I want you to point to your nose like this with one arm on alternate side. So you use this hand like this, you turn your hands like this and alternate your hands. Go ahead and do that. Okay, thank you. He can be able to do that. So I will do a coordination and fine motor, which I will ask you to close your eyes and move your hands up and down and touch your thigh like this. Thank you. I think there's good coordination. So then I'll go ahead and do a lumbar test, which I'll ask you to stand up and close your eyes, and I'll count for 1 minute to see whether there's any swaying or loss of balance. I'll be here for safety. Okay, thank you. And for that 1 minute, I just observed normal swaying and no any imbalance. So then I'll go ahead and do a gait and posture test. So John, I'll ask you to walk a few steps this way and come back. I don't notice any shuffling gait. His stride and swing is good. He has adequate arm swing, and his feet are passing each other. So I didn't notice anything of concern. I will go ahead and do what? I think I'm done for now. So I'll go ahead and perform hand hygiene, document the findings, and yeah, thank you.